Hi there, I'm Tiffany Mann, Care Manager and Advocate with LifeLinks Care Management Group. Today I'm going to talk to you about beginning the journey with dementia, and we're going to address 10 action items that every family should take or think about when preparing for their journey with dementia. I will assist you with evaluating the needs and connecting with resources that will better assist you along your journey. Some of you watching today may be at the very beginning point. You may be with a loved one newly diagnosed. You may be concerned about yourself. Maybe your loved one's a bit farther along, and maybe you're at the end stages of this journey. You may be asking yourself, why do I need to think about the journey with dementia? And it's important that you think about these things to help you plan for that journey. So the first thing I want you to know when we address the action items today is that knowledge is power. The more you know about what your loved one is dealing with, the better prepared you can be for going forward. As well, hopefully with that, the better quality of life both you and your loved one will have. Also, I believe that when you have more knowledge and better quality of life, you can have more compassion for your loved one, and you'll understand more about why they are doing what they are doing. Finally, you will feel empowered. And not only you will feel empowered, but your loved one will feel empowered. They will get a chance to help you make decisions for their future, and you will have a better handle on that future. So the first thing I want to talk to you today about is disease knowledge. What do you need to know about dementia? Well, first off, I want you to know dementia is a general term. It's a general term for the loss of cognitive functioning. And there can be mimicking dementias out there. These are physical and mental health ailments that can look like dementia. For example, vitamin deficiencies, hormonal changes, thyroid problems, severe depression. Sometimes those things can get so bad that we think ourselves or someone we love is experiencing dementia. But in reality, when those things are addressed and taken care of, the dementia will go away. You also need to know that there are different types of dementia. If a doctor says dementia, you should ask, what type is it? What is causing my loved one's dementia? Most of us have heard of Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia. They're all a bit different, both in their symptoms and in their progression. So it's important to know what your loved one's dealing with. 70% of dementia cases are related to Alzheimer's disease. For a resource, I want you to go to the Alzheimer's Association at alz.org. There you will be able to find out a lot more about the different types of dementia. The second thing I want to talk to you today about is your doctor, your loved one's doctor or your doctor, whoever's dealing with the disease. Some families will stick with a PCP, a primary care physician. Other families will go on to see a specialty doctor like a neurologist, a geriatrician, or a geriatric psychiatrist. So what's important? Who do you need to see? For some families, it's important to stay in their community and stay with their primary care doctor. Other families feel more comfortable going on to a specialist. What I think is important is that this doctor will be a resource for you. So it's important that you feel comfortable with who you are seeing and their knowledge behind the disease. You can also visit the Alzheimer's Association to find a list of local specialty doctors in your area. Now let's move on to legal and financial as well as healthcare issues. Have you made plans to address these? What I'm talking about here is the power of attorney. Have you made plans to have a financial power of attorney as well as a healthcare power of attorney put in place for your loved one? Why is this important early in the disease? Well, it's important because we want to give that person that's diagnosed the opportunity to tell their loved ones what they want for their future and what they want to be done, and who they want to be in charge of it. As well, it's a safety issue. We know that judgment and reasoning can be affected with the disease, so we want to make sure that we address those financial issues early so that that person that's experiencing dementia doesn't put themselves in any kind of harmful situation. If you're looking for an elder law attorney, you can visit the National Association of Elder Law Attorneys at naela.org. Now we're going to move on to safety. Have you made plans to address safety as the needs of the disease progress? What am I talking about here? Well, first off, cooking. Is your loved one still cooking? Could they still be cooking and leaving the stove on, or putting things in the microwave that don't belong there? What about power tools? Did your loved one love to do handyman projects? Could they be getting out in the yard and operating machinery that could be harmful to themselves, or getting up on tall ladders? That brings me to changes in elevation. We know that as the disease progresses, their spatial ability is affected. So if your loved one were to fall or to trip on a stair, if they needed help, would they know how to call 911? What about medications? Are they still able to take their medications safely alone? If there are other medications in the home, would they know not to get into those? That brings me to wandering. We know that 6 out of 10 people with Alzheimer's disease will wander. This happens because they become confused or fearful about where they're at. Have you addressed wandering in the home? As well as guns. Are there guns in the home? We definitely know there have been times where people with dementia don't recognize their caregivers and end up harming them. And finally, driving. Are they still driving, and is it safe? We're going to get to driving further here in just a minute, but I want to make sure you have some resources to address your safety concerns. There are definitely medical ID bracelets you can purchase for your loved one, or GPS systems that you can put on their phone to keep a safe eye on them. As well, some families will look into cameras in the home or alarms for the door. Safety is definitely one of those #1 things to address early. Okay, now we're going to move on to how the person's doing with daily living activities. And what I mean by this is things like hygiene. We know that the disease can affect their routine. So are they keeping up with hygiene? How are they doing with managing that money? Again, the money question comes in. Can they safely manage their money? What about meal preparation? Do they know how to prepare meals? That even goes to say, do they know how to heat up a meal if you were to bring them one in the microwave? Cleaning. Are they keeping their house clean? Do they still feel comfortable going out and shopping for things that they may need? What resource I have for you here is a list of people that you can reach out to help meet the needs of your loved one. Family, friends, neighbors, in-home health care, adult daycare, a CPA. There are many resources in your local community I encourage you to look into. Our 6th action item is going to be personal care, and this ties right into the activities of daily living that we just discussed. Are you comfortable with your ability to provide your loved one personal care? This takes a lot of patience. It also takes being an investigator and really figuring out where your loved one's at in the disease. What stage are they at? What are their true needs? And then with personal care comes communication. We know that this disease affects their ability to communicate to you and their ability to understand what you are telling them. Do you know what they need, what they want, or how they're feeling? All of this is going to play into personal care. I would encourage you to reach out to the same resources I named just a minute ago when we talked about daily living activities. In-home care, home health care, those type of resources can be helpful to you in the home while you are providing personal care. The 7th action item to talk about to you today is future care. Are you worried about how you will pay for future care? For many families, they have an expectation that they want to keep their loved one at home, which is very understandable. But I would encourage you to always have a plan B. A plan B could include in-home care, adult daycare, assisted living facilities, memory care, skilled nursing. The next question would be, I'm sure you're wondering, is how do you pay for care? This comes into play when you look into long-term care insurance or VA benefits if that person is a veteran. Some families have saved up money and have private pay money to afford for this service. Others will qualify for Medicaid as they progress in the disease. There are resources in your local community to provide caregivers respite. So even if your plans are to keep your loved one at home, you might still need a break. This is where you can reach out to companies like the Tennessee Respite Coalition or the Area Agency on Aging and Disability. They may have grants that can give you funds to get a break because we know caregivers are going to need it. Next, we're going to move on to behaviors. Do you feel comfortable with your ability to respond to these behaviors? When I say behaviors, I mean things like agitation, aggression, confusion, repetition, anxiety. Sometimes these things can get very stirred up in a person with dementia. They can create trouble for the caregiver providing care. Some tips I want you to know is that number one, usually there's always a purpose to their behavior. It's usually them trying to communicate to their loved one, what do they need, what do they want, what are they frustrated about. A couple tips to give you around behaviors would be number one, don't argue, reason, or explain. The word are. Don't argue, reason, or explain. Enter into their reality. Where are they at? What's happening around them? Listen for the need, the feeling, or the want. Again, you become that investigator. And once you think you've figured out what might be causing them trouble, reassure them that they're safe and you're there with them, and redirect them on to the next activity. All right, we're coming into the home stretch of our action items. The next one, number 9, will be driving. Ask yourself, is it safe for your loved one to be driving, and how do you have the conversation when it's time to stop driving? A couple tips I would give you around this is number 1, ride with them. See if they still remember the rules of the road. Can they operate the car correctly? Do they still know how to get to familiar locations? If you can't ride with them, I would encourage you to inspect the car. Look around the car when you're there for visits to see if you see any dings that would probably tell you maybe they've had minor driving accidents. Next, I would encourage you to have a plan B for them. We know that driving represents a lot of who we are in our independence. So they need a plan B to get to those places that they enjoy going. If they won't give up the keys, just know that there are resources out there to help you with this, both at the Alzheimer's Association and probably in your local community at a driving evaluation center. The resource for you here would be to go visit the Alzheimer's Association and look up your local driving evaluation center. The last one we're going to talk about today, the last action item, is caregiver stress. Do you feel overwhelmed by your responsibilities as a caregiver? We know that the role as a caregiver can be very, very overwhelming. And I put this last to let you know this really is number 1. The first thing I would tell you to do is attend a support group. Most communities have local support groups for caregivers affected by dementia. The next thing I would say to do is talk to a counselor. We know that family dynamics and past experiences don't go away just because the disease is there. Sometimes it does a caregiver good to talk to a counselor about the individual things they're experiencing in their new role. Also, learn the signs of caregiver burnout and how to be a healthy caregiver. Again, this one's most important. Take care of you. Take care of you first. Okay, a couple things to remember from our talk today. Number 1, remember that every person and journey is different. Your experience with your loved one is going to be just that. It's not a cookie-cutter disease. Everyone's going to experience this journey differently. The second thing to remember is communication is key. Not only that you continue throughout the disease to communicate with your loved one, but also that you keep an open line of communication with those involved in their care. Third, I would tell you just decide on your priorities. What's important right now? What are your biggest concerns? And then make those long-term goals. Finally, reach out to resources. Your community is full of them. And again, develop that plan B. Finally, remember that you are not alone. The Alzheimer's Association is there 24/7, as well as the company I'm with, LifeLinks. Again, thank you for listening today, and please know that you are not alone.
Hello, I'm Cindy Natch with A Better Nest. We're a home livability consultancy. We help folks that want to age in place do that more successfully. A home can work for you or against you as you age. Whether you've lived in your house for 5 months, 5 years, or for 50 years, your home should feel that it's comfortable, familiar, and secure. And when I say those things, I know it's different for every individual. What you think is familiar, comfortable, and secure may be different between you and the next person. But as a caregiver, you have the opportunity, a unique opportunity, in which to help mold the current environment to be the best physical caregiving environment that it can be. And so you get to meld your idea as a caregiver and the person you're caring for's ideas together in order to create a good caregiving environment. So in that, I think that there are a couple of paths that we need to take in order to create a caregiving environment. How does that house or that home really look and work for you? So a couple of ideas. Two paths we need to take. One is understanding what and how the impact is environmenting your care. And two, then learning from that gathering of information in a simple way and taking action on those items that you learned. So let me give you an example. So I was speaking to a son not too long ago, and he is part of a family caregiving team. And that family caregiving team, his role is to go on Tuesday after work and Sunday mornings to see his mom, which I said, you know, that's a great plan. And he said, I feel really good about what we've got constructed for my mom with the different family care, care team going on. He said, but I feel bad when I come on Tuesday and Sunday. And I said, why do you feel bad? I think that's a great effort on your behalf. He said, because when I get there, I kind of want to leave really quick. I'm there not more than 15 or 20 minutes. And I said, why? And he says, because I'm so hot. Now, how many of us have heard or felt when we go to lend care that the environment itself, it's really hot outside? And I said, would you be willing to listen to a couple of ideas? And he said, sure. And I said, so just from a matter of observation, when you go to see your mom on Tuesday evening, I said, just walk by her thermostat and see what the temperature is. Don't make a big deal out of it, just go see what the temperature is. And then when you do it on Sunday morning, run by that thermostat again and just make note of the temperature. Did it change from the last time you were here in the evening versus in the morning? Gain that information, and then I'll give you two suggestions, only two, but try this the next time you go out. Give your mom a call about an hour before your visit and ask her if she wouldn't mind turning down the thermostat. In that way, she knows that you've asked her to do something for you, and tell her why. Say, Mom, last time I was there, I kind of left quickly. I wanted to spend a little bit more time, but I was just so hot that I just had to kind of get up and go. And I know I want to spend more time with you, and I know that you want to spend more time with me, so I just ask you to turn that down. And the second thing you can do, son, is to simply employ some of the newest technology we have on thermostats. And from the comfort of your car and your phone, you can raise and lower, if your mom's in approval, you can raise and lower the temperature so that when you're caregiving, you're there, you're engaged in her and not worried that you're going to sweat and that you're going to feel hot and that you're uncomfortable and want to leave. So temperature is a big part of a home environment. And if you're caregiving, you need to make sure the temperature works for you and for the person you're caring for. Another instance of gaining information and then using that information is that I have had a circumstance with my mom. She was bemoaning the fact that my father didn't read as much as he used to read. And one of the things that I used to do when I went home to caregive, I'd spend an entire weekend, 48 hours, nonstop, so that I could really see what was happening. And so the next morning, it was a Saturday morning, I watched my dad. He had his normal reading routine of reading the newspaper. And he did that in the morning. And in the evening, he didn't read anymore. He used to read all the time. And I got to thinking about that. And I thought the next day, I'm going to look at it again. So Sunday, he got up and read the paper. In the evening, he didn't. So it got me thinking about the environment. It got me thinking about lighting. And I knew that when he read the paper in the morning, there was a big window behind him. And that big window gave him ambient light that was really good and clean. And the next day, I looked at his lamp, and it was a three-way lamp with a one-way bulb. So I changed that lamp I changed that bulb to put in that lamp that could handle 3 different designations. And the next evening, I sat next to him and I said, Dad, I said, hey, you want to check that lamp? And sure enough, he turned that lamp on. And you know what? He read that night. Sometimes we make assumptions that somebody can't read because they can't see. Well, maybe they can't see from a real issue of vision, or maybe they can't see because the lighting is not so hot. So when we take the time to really observe and listen before we make decisions in terms of the home environment, it makes for a very good opportunity to change the home environment to improve the caregiving situation. I think we as caregivers often make an assumption based on what we know without the observation of what's really happening for our loved one. Sometimes our loved ones can't make a determination if you tell them, hey, what would you like for lunch? Would you like chicken, or would you like tuna, or would you like beef? And they say, oh, whatever you think's good for me. Maybe if you just change the phrasing of your ask, hey, would you like chicken today? Simple yes, no answer makes all the difference. Could be the same with lighting. So let's think about how the home itself does and can work for us or against us as we age. So as we're talking about lighting, let me give you a couple of tips that I think the list could be very long in terms of tips. But let's go ahead and think about maybe the top 4 things or top 3 things that would be very impactful in a quick way in a caregiving situation. Number 1, I'm going to say light it up. Task lights, any kind of lamps, make sure they have the appropriate bulbs. Motion lights, trigger lights, light it up. More often than not, when folks start to disengage, lighting plays a role in it. And we don't think of the house and how the lighting in the house impacts our ability to do our tasks. If someone loves to cook and they cannot see the surface between the countertop and the stove, that's a real problem. That's a real security, a real safety issue. So light it up. Number 2, buy a bidet. B-I-D-E-T. Bidets are not as well known as they are in Europe and Asia. In fact, the first bidet, which is a toileting and cleaning mechanism at the same time, the first bidet was identified in France in like the 1700s. They become very popular in Europe and in Asia, but they're just now seeking popularity and gaining popularity in the United States. What the bidet does is if someone can walk to the bathroom, utilize the toilet, then the bidet cleanses. Talk about an elongation of dignity for each and every one of us if we are able to not only use the bathroom on our own, but have ourselves cleaned in a way that's respectful and allows us to do that for much longer. So that bidet is now being carried in some of the bigger box stores, and so the cost of the bidet has gone down. So buy a bidet, get lit, clean the clutter, clear the clutter. Having worked with folks for a number of years and being intimate with how people view clutter in their home, and everybody views it differently, what I've come to ascertain 100% is that clutter impacts us psychologically and physiologically as we age. The message that I would love to send is that less is more. Having less clutter helps you, caregiver, create an environment that is easier to work within, that is safer, more secure for the person that you are providing care for. And when you step into helping clear the clutter, I'd like for you to know that it's as individual again as you and I are in terms of how folks view clutter. And therefore, if you just go in and clean up a room, you may be impacting the person you're caring for in a negative way. You've got to have some conversation, and you've got to make an agreement on what's going to be the best care environment relative to clutter before you go and start tearing everything up and start calling the donations and taking everything out. So clutter can directly impact the home environment. So both from a care standpoint and how you feel in a cluttered environment, as well as the care that's being given to the actual client. I guess the last thing as the maybe top 4 tips would be to raise it up. And really what I'm talking about there is raising your furniture up. So have you ever had a loved one that sat in their favorite chair or sat on their sofa? And if you were with that loved one for a number of hours, let's say you were there for 24 hours, or let's say you were there for a family gathering of 7 or 8 hours, and did you note that your family member sat in that sofa but never got out of that sofa? If you ever note that, you need to ask yourself, why is that? Could it be that the sofa itself is an impediment in the care environment? Well, that happened in my circumstance with, again, my mom. I couldn't understand quite why she was sitting so much, and then I watched her get out of the chair. And when she got out of her chair, same thing with a chair and a sofa, they're the same height, but she could not physically get out of that sofa without a tremendous amount of pain. And to watch her was painful to watch, but it took everything she had. At that moment, early on, we decided that she needed some risers. They're very inexpensive. You can find them all over town. And they allow you to increase the height so that it's easier to sit in of your chairs and even your beds and your sofas. That one action made a huge difference for her in enjoyment. So those are just a few things that I can share with you today to talk about how you further making your home a better environment. Caregivers, you are blessed, and who you're caring for is blessed to have you. It might be one of the deepest relationships that we ever have in our life is really truly a caregiving relationship. So whatever you can do to help improve your time there, as well as the person you're caring for, it all matters. And it all matters, and you should walk in confidence that what you do through learning and then actualizing will really impact and help the end goal, which is good quality of care. So remember that your home can work for you instead of against you as you age.
Hello, my name is Beverly Patnack. I am the Director of Staff Training and Community Engagement for Abe's Garden, a memory center here in Nashville, Tennessee. Today I'd like to share with you some ideas about keeping people who live with you engaged when they have dementia. As you probably already know, it's not an easy thing to understand the complexities of Alzheimer's disease and other dementias. So just at the beginning, I want to say one size does not fit all. So as I give you some of these tips for keeping your loved one engaged, remember that every day's different, and as the disease progresses, things will change. So what works one month may not work the next month. But the other important thing that I want you to know is that all persons who have any kind of dementia still have assets. And so as the care person or care provider, you'll want to figure out what those assets are. So I'm going to talk about probably 4 or 5 different areas that you might want to focus on in doing things with your person who has dementia. One of the things that we know is most effective is all kinds of music. Now, you or your loved one with dementia may or not play an instrument, but you may have friends who do. So invite them over to play music. You may want to get an iPod with some earphones and let them listen to books on tape or to their favorite music. You also may want to sing with people, because what we know from the research is that when a person with dementia is singing, then they're less likely to have behaviors that are hard to deal with. So it's really important to use music. You can also use music as background during meals. It seems to calm people down, helps them stay seated, and they eat their meals more. You can also, there's a interesting thing, a karaoke website called allmusic.com that you can get karaoke songs and you can sing together, bring in friends and have a karaoke time. We just know that the memories of music is one of the places in the brain that is the last to go. So use music throughout the progression of the disease. Another thing that you can and should do is keep your loved one moving. Movement is very important. So if your loved one is in the early stages, you may want to take walks together, go to the park, do things outside like plant flowers, play cornhole, get a little putting green set up with plastic balls, anything that creates movement. You can also dance, particularly if you were dancers in your early or younger years. Dancing combines two things or three things: movement, music, and touching. And it's also important to remember that as we get older, we still need to be touched. And that dancing is a great way to do that. Another area that you want to think about is, how do I keep my loved one engaged in the activities of daily life? So some ideas for that is have them help you with household chores, dusting, wiping off the countertops, washing plastic or metal dishes, filling the glasses with water. You might make pudding, instant pudding, letting them stir and then serving that pudding for dinner, after dinner, or before dinner, whichever. Those kinds of activities help people feel like they're still part of the household. Folding towels, sorting silverware, setting the table, using sometimes a template so that people know to put the placemat down, the silverware, the napkins. It doesn't matter if they're perfect or not, just that they're being part of the household and continuing to feel useful and important. A third thing that people often forget is using things that people can touch. So making pottery or things out of clay. You can even use things that children use to craft things that are tactile. So if somebody has been a quilter or a crocheter or knitter, continue to use those skills as long as possible. Also, you can make quilt squares, and then you can perhaps sew them together and give them to the grandchildren. And these don't have to be, these kinds of things can be for both men and women. There's not really male and female roles when you have dementia. The important thing to remember is you have to be in the present with somebody who has dementia. They're not able to necessarily think about the future nor remember very well the past. So it's important when you're, say, looking at a photo album, which is often a very fun thing to do, not to say, "Do you remember Bob?" but to say, "Here's a great picture of Bob. He was our next door neighbor when we lived in Sodoma." You give them enough information so that they can hook on to a memory. But if you ask them a question, then the anxiety comes in because they can't quite get it. So as you're looking through magazines and photo albums and other things like that, remember how you communicate is as important as the activity that you're doing. It's also good to involve other people, as I mentioned earlier. Have friends come over, continue to have meals together as long as possible. Include the person in the activities as far as they can be. So, for example, though, if you go out to a restaurant, don't sit the person with dementia so that they see all the everybody in the restaurant. Put them with their back to the rest of the restaurant so that they are not overwhelmed by the environment. And also with the menu, if you look at lots of menus today, there are just lots of choices. So remember what they liked and say, would you like to have lasagna or spaghetti with meatballs tonight? Just give them limited choices. That seems to work better with people who have dementia. It's also important as people with dementia spend time with others to help other people understand what's going on. It's not a fearful disease, but a lot of people are uncomfortable with it. So, you know, if you're going to take somebody to the dentist, call ahead and say, my wife, my husband has dementia now, and I just wanted you to know so that you can be prepared for that. As the disease goes on, people can do maybe less and less of the very active things, but they can still do a lot of things. So one of the things that you might do with somebody who's in the latter stages, besides the music, is to sort cards by color, to sort jewelry by earrings, by necklaces, by rings, any kind of thing you can think of to sort that often works very well. The other thing you can do, and this is great with grandchildren, is to have a soft ball, a Nerf ball, and just sit at the table and roll it to each other. You can also get a balloon and pat it, which helps with the movement piece as people are in the latter stages. Everybody loves a balloon, so that sense does not go away. As we think about people in the latter stages who are not able to move as much as they can earlier, you know, we still need to think about what can they appreciate. So listening to music, as I said, doing some activities. You may not think that they're responding to the music, but even if you see them tapping their toes, that means that somewhere inside they're hearing that music and responding to it. You know, people in wheelchairs can dance. You know, if you move them around, it's a good thing and brings back happy feelings as they do that. You can do photography with people who have dementia. In our memory care community, we have a program for early stage people who've just been diagnosed as early stage dementia. And they're doing things like learning to take photographs, and they're going to have a show with their photographs. They are also learning Spanish. They are learning Tai Chi and yoga. The most important thing is they're forming a community. And as I've said several times during this talk, you need to keep bringing in friends, because once people have that diagnosis, what do they lose? They lose their sense of community. They may have to quit their job. They may feel isolated. They may be embarrassed. So if there are ways to form a community, could be people meeting for coffee every day or every other day, those kinds of things are very important for people to feel as though they're still contributing to society. We know just about this much about dementia, and the brain is a very complicated thing, but what we do know sometimes is depressing. Alzheimer's and other dementias are progressive disease ending in death. There's no medicine that cures it or surgery. So what we want to emphasize is making the best, the quality of life, the best it can be during this disease process.
Hello, I'm Clara Kelly. I'm your family caregiver specialist at the Area Agency on Aging and Disability here in Middle Tennessee. At your local Area Agency on Aging and Disability, which is located within the entire United States of America and its territories, you will find what's called the Family Caregiver Support Program. That program is designed not only for education and encouragement and support, but more than anything else, we provide respite, or pretty much respite is simply taking a break. When you take a break, whether it's an hour here or a day here or whatever it is, you rejuvenate yourself. At the local Area Agency on Aging, we offer several types of respite. One is adult daycare, where we will pay for the adult daycare and with one of our contracted providers. We offer in-home respite, which is pretty much a companion, someone to sit with your loved one while you get away. We offer personal care respite, which provides assistance with bathing and toileting and dressing on a regular basis as you need it. And we also offer homemaking respite, which, like I tell people, it is not a maid service, but rather it is designed to keep the care receiver's bedroom, bathroom, laundry, those type areas clean. We also provide in-home dementia education, which is provided by the Mental Health Association, and that is totally free whether you're a client or not. And for each of our services, we cover 13 counties of Middle Tennessee. I'm here today to talk to you about the effects that stress has on you as a caregiver, because we realize that stress covers every facet of your person. It covers your spiritual, physical, emotional, mental, financial, every aspect of you as a person. Most of us realize that you don't do what you do for the glory of it, but rather because you love the one that you're caring for. And if you don't take care of yourself, you can't take care of anyone else. It's like you're trying to drive a car without any gasoline. It's impossible. You can't do it. So I know many of you are saying, well, I don't have time to take care of myself. I have to take care of the person I love. I understand that, but you must find ways to take care of self. I would like to present to you a few ideas on how you can do that in a practical way. One, I want each of you to realize that it is very vital for you to know that it's okay to say no and to set your boundaries. Your care receiver, your family, your friends, different ones may try to tell you how you should do what you should do, but you recognize your own strengths and limitations better than anyone else. So it's okay to say no and set your own boundaries. Don't let other people set them for you. Your care receiver may often try to do what I call pushing the buttons. They know what upsets you. They know what frustrates you. Don't allow it to happen. You set your boundaries, and it's okay to say no. Second, I'd like to tell you that your feelings and your thoughts are your own. No one can control those but you. People may try to tell you you should feel like this and you should be happy all the time, but that's not true. I know, and you know, that there are moments that you have frustrations and that you just want to throw your hands up in the air and shout, scream, or cry. What I recommend for you to do is during those moments, go to your restroom, have your cry, wash your face, put your happy face back on, and go out and continue to do what you do best. Don't let anyone, not even the care receiver, make you feel guilty for your thoughts. But most of all, when you have those moments, when you have those times, do not allow the care receiver to see it. Because in most times, if they were able to control themselves, they wouldn't act like that. Next, I want you to learn your local resources. You've already previously been told about the various resources here in Middle Tennessee. Use them. Don't be afraid. It's okay to reach out and get help. A wise person knows that they can't do everything by themselves, and they won't try to. But instead, I would like for you to know your resources. Your resources can include the Area Agency on Aging that we've already discussed. They can include your Council on Aging, Mental Health Association, Tennessee Respite Coalition, your local places of worship, your senior centers. Resources are available to you. Do not try to do it by yourself. You can't do it without breaking. And we try to catch you before you break. So do not be ashamed if you have to reach out and get help. Next, if I were to ask each of you, when's the last time your loved one saw a doctor? You can tell me the date, the hospital, the doctor's name, the diagnoses, the medications. You could tell me everything. But if I were to ask you the same question about yourself, most of you would have no idea when you last saw a doctor. Most of you would have no idea if you've even seen a doctor. You must make and keep your own doctor's appointments just as well as you make sure your loved one keeps theirs. If you're not taking care of your own health, you cannot continue to take care of others. I've seen too many cases where the caregiver literally broke down physically and mentally because they weren't getting the help they needed. See your doctors. Make sure that you're taking your medication. Make sure that you're following your doctor's orders on whatever it is you need to do to take care of self. You have to make sure that you take care of yourself in order for you to be able to continue to care for others. In the 16 years that I've been doing this job, I literally have seen caregivers die from the stress of caring for their loved ones. You cannot get to that point. If you want to continue caring for your loved one, you must take care of yourself first. Next, while you're taking care of yourself, you need to eat regular meals and eat healthy meals. You have to take care of your nutritional needs. Making sure your loved one gets their meals is fine, and that's great. But what are you doing to take care of yourself and making sure you're getting your proper nutrition? Next, take time for yourself, realizing that you cannot do everything by yourself. Many times people, whether family or friends or neighbors, reach out and ask, what can I do to help? And sometimes out of shyness or you wanting to be a martyr, you say, nothing, I can do it. That's not true. Allow them to maybe fix a meal once a week or to come over and do a load of laundry for you. Allow them to go grocery shopping for you, and better yet, have them sit with your loved one while you go grocery shopping. Give yourself a break. But be honest with yourself, realizing that you cannot do everything by yourself and you must have help. Next, I'd like to talk to you about acknowledge that not everyone in your circle, whether it's family or friends, is going to want to help. Oftentimes, this is left on the caregiver solely. Be honest and reach out and get what help you can, but at the same time, acknowledge the fact that not everybody that's in your circle is wanting to help, and oftentimes it's just going to be you. Don't let that get under your skin. Too many times the caregivers feel like, since no one helps them, they feel like that no one cares. Their blood pressure goes up. Again, another reason to see your doctor. And when your blood pressure goes up and you get stressed out, what if something happens to you, which is quite common? So if you want to continue in your role as a caregiver, just let it go if you realize that nobody else is going to help you. I've seen families where there have been several siblings, and all the caregiving responsibility falls on one person. It's okay. Acknowledge that that's a reality and move on. Another thing I want to tell you is that being a caregiver is just one of your roles. One day, your role as a primary caregiver will end, whether it's because of institutionalism or death. But one day, it will end. If it's institutionalism, I want you to remember, you're still a caregiver, you just now have professional assistance in doing what you were doing. But if it's by death, remember, you're somebody's mother, or wife, or father, or brother, or sister, or cousin. You're somebody's other relative. Caregiving is not your only role. So with that said, be ready to pick up where you left off Maybe it's returning to the workforce. Maybe it's reading a good book with your feet put up. Maybe it's just traveling. Whatever it is you wanted to do prior to your role as a primary caregiver, do it. Your life continues. As a final thought, stay focused on the fact that you're doing your best and let no one tell you different. You may not do it the way someone else would do it, but you're doing your best, and that's what matters. So you give what you've got, realizing that you've got to take care of self in order to continue taking care of whoever you're taking care of. But take care of yourself first, and care for self before caring for others. Caring for self is your primary role. Caring for someone else comes afterwards. But if you don't care for yourself first, you're not going to be able to care for anyone else. Thank you.
Hi, I'm Casey Martin. I'm with the Council on Aging of Middle Tennessee, and I serve as their outreach coordinator. My job is to get to tell the great story about seniors, older adults in Middle Tennessee, and share resources for hopefully aging better and tools for families and caregivers as well. Our job at Council on Aging is to look at unmet needs, identify them, and then plug in different resources for older adults, their families, and caregivers by plugging in and looking at different education sources, also resources for information, and then also advocacy where necessary. You may know us. We publish the Directory of Services for Seniors. We've been doing that for about 20 plus years now, and it is a comprehensive guide for everything for older adults in Middle Tennessee in a 13-county area that we serve. We're certainly proud to do so. It's certainly a privilege to be able to do that. So we are looking at today some of the community resources that are available. One thing that we realized in our work in identifying unmet needs is that while there are lots of great resources, it can also be overwhelming when you start the process of looking at what do I need for my mom or dad? What do I look at as an adult child living maybe out of state and I need to access information that's solely right there in Middle Tennessee? And it can just be a matter of sorting through what's right for you, what's right for your family, and then making a really good choice, hopefully, from that information. So today we're going to walk through some of those community resources. They are range in everything from legal, insurance, help at home, to living arrangements. And actually that's where we're going to start. What it looks like for senior living, what is a good community for senior living, and really what are those and maybe what are some of the benefits. So I've broken it down just into 4 groups when you talk about living maybe outside the home that you've known for so long and selecting a place, a senior living or retirement community. The first would be independent living. I think second would probably fall under assisted living. The third would be memory care, and then the fourth would be skilled care. So let's rewind a little bit. We're going to look at independent living. The definition, I think, is pretty easy. Independent living really looks like any other independent or any other apartment that you would find anywhere, with the exception that in a senior independent living facility, sometimes that can look more like maybe a resort type independent living. It can look more like a retirement community with a lot of amenities. But basically what you're going to find in independent living for older adults is an apartment. And the great thing about that is it is independent. So it's an apartment for anybody, just like anybody would find anywhere, except in this, it's going to have that support of other older adults who are there. So great folks who have a lot in common. And then also you're going to find hopefully a little bit of added security. maybe a check-in to make sure that folks are up in the morning, has a little bit of a check-in, have someone, just a little bit of an oversight to make sure that they're okay. As we move into that next level of care with assisted living, you're going to find additional support. So an assisted living typically looks like an apartment building. It might have maybe just one floor, so maybe about 30 or 40 apartments typically is what we see in Middle Tennessee. But you're going to have an apartment that maybe has a smaller floor plan, and then other really larger and nice community areas so that folks can get out. It helps with isolation. You get to make friends, have some really great social time, and also social programming. With an assisted living also comes those additional resources or support that maybe an older adult might need. So it looks like things like, definitely you have the apartment. You also have maybe 3 meals a day, usually designed by dietary specialists who are also very well versed in the nutritional needs of older adults. But you also have things like that great life enrichment. You have maybe some transportation. You have things like medication reminders, oversight for just making sure that folks are also, I guess, on a health level where they need to be, and also maintaining that level. So if there's a decline in health in any way, whether that's physical or cognitive, the staff at that particular assisted living can say, hey, this is what we're seeing. You may want to make another visit to the doctor, or you may want to provide some additional oversight for medication, or we're seeing a little bit of a change in behavior. Are you all aware of this? And it's a really great conduit between that particular resident and their family. When we look at kind of getting to that next level of memory care, it is exactly what it sounds like. It is a community for folks who have residents and patients who have a specific diagnosis of dementia of some sort. The benefit is that in a memory care community, you have additional security. That can be a real issue for folks who maybe have dementia or Alzheimer's. And then also you have a staff who is very well versed and well trained specifically for the care of dementia residents. So whether that's redirecting behaviors in a loving and compassionate way, or whether that is creating some really terrific life enrichment activities so that particular place in a person's life is as rich as any other place in their life, is a terrific thing. The folks who are in those, I guess the staff really who are in those particular communities are well trained specifically for dementia care. And it is something to see. There are terrific, I think, communities that are here in Middle Tennessee, and I would certainly encourage you to look into those. As we go through some of these living situations, I guess, or communities, it's also important to keep in mind to look at each one of them. Take your list with you. What's important to you? What's important to the quality of life of your loved one? Make sure that what you're seeing and that as you tour, and I do suggest that you tour and take your time in doing so, but as you're looking at that particular community, what stands out is that's something that's going to be a benefit, that's going to be a good fit for personality, certainly that's going to be a good fit for good health. The fourth level of senior or older adult care is skilled care. A lot of us in this area know that as a nursing home. It is really more for more frail or sicker older adults who have a health situation that cannot be maybe cared for in the proper way at home, or would be too taxing to also have in an assisted living setting. Those medical issues can be addressed on a very, I think, competent basis. I think a lot of times those skilled care facilities get sometimes a bad rap. Sometimes they're in the news for not so positive stories, but there are really, really strong positive levels of care and communities in Middle Tennessee that would be a really great recommendation for anyone who needs that particular level of care. So that's kind of living communities, at least the four as I see it as kind of a top four, if you will. You can break those down, and there are also combinations of communities that have different levels together. So there may be some that are all of those levels on one campus or even under one roof. There may be some that are maybe have independent living, but then also, just as a little bit of an aside, they'll also have a smaller unit for memory care as well, or they may have a memory care and a skilled care together. So look at those again for what was right for your family. Sometimes couples want to stay together. So if one of the folks, maybe the gentleman needs a little bit more care, but the wife doesn't, then they can stay together in the same community, but have the different levels of care that meet their particular cognitive and also physical needs. As we're looking at also kind of the home situation, I think it's important to look at two separate kind of schools of thought or separate things. One is the help at home and also help with home. So if moving is not an option or it's not desirable for whatever reason, it's really important to know what your options are for help at home. Those can come in the form of a non-medical home care, and I'll explain what that means in a minute. Also, home health care, which is also very important. And then we also have respite care and also things like community support, which we'll get to in a minute. So non-medical home care sounds like kind of a big term, but really what we've known it as a lot is a sitter service or private duty service. It's been called a few things over the years as the process and service has evolved. But basically what it means is to come into someone's home. It's a companion who comes in. Maybe it's just for isolation. Maybe it is for those medication reminders during the day because there's an adult child who's maybe working during the day. They can't be home. But to come in and help mom or dad might be a really good thing just so they have that companionship during the day. It also is great. That person may come in and do light housekeeping or meal preparation. They may come in and do maybe a little bit of laundry, but mostly it's just to make sure that that particular older adult has some great companionship during the day and that they're not alone for a lot of different reasons. It's also great for security as well, and certainly peace of mind for that caregiver. When we're looking at home health care, that is usually under a doctor's order. It is not something that just the general public can order home health. That has to be under a doctor's order. It is for someone who is considered homebound, either temporarily or not. And it also means that there is a skill or there is something that that person needs in terms of their daily living, or maybe they need care with a wound care, or they need a particular therapy like physical therapy or occupational therapy, and they need it just every once in a while. Maybe it's 2 or 3 days a week that home health care provider can come in. Sometimes it's an LPN or a nurse, but oftentimes it can also be a CNA or a nurse's assistant that will come in and help with those acts of daily living like bathing and dressing. Then we have one of my favorites, and I think the most maybe most underused service, which is respite care. In Middle Tennessee, the Tennessee Respite Coalition is a terrific resource for folks in this area who are looking for, maybe they're caring for someone at home, but they need just a little bit of a break. And whether that's a week or whether that's a few hours a day or maybe just a few hours a week, Tennessee Respite Coalition is a wonderful resource. They can provide and find, and I think they also vet specific caregivers, but they also can provide, I believe, some financial support as well for some of those caregivers. So be sure to look them up, and if that is something that you need. And then really, I say always, when you're looking for help at home, look at your community resources. Look at your communities of faith. Look at your neighborhood. Find friends maybe who are in a similar boat. Find support groups that are in this particular area, and look and see how you can maybe help each other and kind of piece things together with a plan that works for both families. So that's help at home. Now we step into help with home. The neat thing that I think has really surfaced in the last several years in senior health care is the fact that there are lots of resources, and that's really great, but there have also been some really niche markets created because families need specific kinds of assistance. So one of those, I think, is the help at home, or help with home rather, market, where you're talking about folks who can actually help with your structure, the house itself. So maybe that's a home modification service, maybe that's a senior move manager, or maybe that is, gosh, I don't know, again, kind of some of those community resources that come in, but also there are senior realty specialists that also look at, okay, this is maybe an older adult who's ready to sell their home they've been in for a while. There are special considerations when moving someone out of a home when they've made their mind up and they're ready to make that move. There are certain considerations to be taken in, looked at, and make sure that that person is, you know, ready to move, what needs to happen, what paperwork needs to be in place. They can really help with the sale of the home, but also buying and looking for that next home. What's appropriate, if that maybe that older adult has physical limitations that are going to maybe they don't need a lot of steps in the house, or they may just need that one floor, or maybe they don't need a garage because they don't have a car, so that's something they can, you know, eliminate. That senior real estate specialist is going to help them find exactly what they need. Kind of backtracking a little bit to that senior move manager, there are terrific resources also in the Middle Tennessee area for senior move managers, and that person I think is invaluable. It's something that over the years in my professional life, I've had the opportunity to refer to, because there have been so many people who've needed that on a different level. So it may be a senior move manager looks at someone who's maybe been in their home for 40 years and said, okay, now it's time to downsize. Now it's time to get things organized or declutter, or maybe it's time that you're going to move into an assisted living. We're going to downsize by several thousand square feet. What are we going to do with all this furniture? And what are you going to take with you? So a senior move manager can help with all of those things, also including an estate sale, if that's something that is warranted. And then they can help organize, help declutter, help pack, definitely help move, and then also get things set up in the new location, which I think has been hugely helpful to families that we've known in this area. The next, I think, with your kind of looking at help with home, if someone decides to stay in their home, one of the great things that have been made available, and a terrific resource here is in the Nashville area, is a home modification specialist. So that person can come in, look at how to make the home safer. Maybe it's eliminating that step from the garage to the kitchen, or maybe that's putting the grab bars in the restroom, or maybe in the kitchen or down the hallway, just making things a little bit more user-friendly, quite frankly, and certainly more safe for that person as we age, who may be having some issues with, maybe it's a little bit of balance, or maybe it's just they've had a surgery and they need to make sure that they're more stable on their feet, and just having some of those things modified a little bit in the house can really, really help that a lot. As we look at moving through some of these other resources, I think it's really important to also talk about end-of-life care. It's a really hard topic sometimes to talk about, but I think it's certainly one that's important. The Council on Aging has a book called Preparing and Planning. I know there are wonderful resources too through several hospices in the area where they have planning documents and that sort of thing. But it is wonderful to be able to have those wishes known and have information set, and families can hopefully start conversation. But as you look at that, and if that's something that I think it needs to be accessed for your family, to look at hospice care and to also look at palliative care are two that are really can be a real gift for families. Hospice care usually comes online and kind of is incorporated into the process when the patient is terminal and they are not expected to survive their illness, but palliative and hospice come alongside and really walk that family and that patient through this end-of-life process. And whether that's counseling the family or the patient, grieving kind of counseling services and walking them through that process, but also knowing what's important in an end-of-life decision-making time so that it can be a peaceful time and hopefully bring families together, which I think is a real gift for that particular level of care. In Tennessee also, we are very, very grateful that there are legal services and elder law attorneys that are available to certainly for us from Council on Aging kind of corner of the world to be able to refer to. These elder law attorneys are very well versed in issues that involve aging population, involve families making decisions for older adults, and they can really walk through a lot with those families and make sure that wishes are known, paperwork is in order, and hopefully keep families as protected as possible. There is also another nonprofit called the Tennessee Justice Center. They have attorneys that are available. I think it's walking through situations that revolve around Medicare and Medicaid and TennCare, and also those eligibility and appeals for Medicare and Medicaid. So Tennessee Justice Center is another great resource to know. And also the Nashville Bar Association will make referrals for attorneys in this particular area. So that also is a great resource I think that folks may not know about, but now you do. So feel free to give them a call at the Nashville Bar Association. The next kind of category of resources we'll talk about is insurance. I think that Medicare and Medicaid can quite frankly be one of the most confusing aspects of older adult issues because it feels like it changes fairly frequently. Folks are trying to kind of keep up with the ins and outs of what they're qualified for, what it covers, all of those sorts of things. When we look at referring folks from the Council on Aging office to other places, one of the great resources we have is the Area Agency on Aging and Disability. It's also known as the AAAD, we call it that for short, but they have terrific programs through their Tennessee SHIP program, which is an insurance assistance program. They also, and that kind of looks at Medicare and Medicaid and can help different clients sort through all of that to know what's covered and what's not, answer their questions, and they're certainly available for that. And then they also have under their umbrella is the Choices program in Tennessee as well. Also, when we're looking at insurance, I think it's important to look at if you have a long-term care insurance policy, long-term care will pay for some parts of maybe long-term, kind of living situation, maybe it's assisted living. Some policies will, but some won't. So I think it's very important if you're looking at have a long-term care policy, be sure that you get with your provider and know exactly what that covers, because not all of those policies cover the same thing. So just know what's in yours and what kind of gets you covered. And then also we look at veterans benefits. There are veterans benefit specialists in this area, but one of the organizations I've become very aware of, and we certainly have through Council on Aging, is Operation Stand Down. They can help veterans, again, sort through that process, know what they're covered by, know what their veteran VA benefits cover, get them to a place where they can understand that a little bit better, and they're a terrific resource in Middle Tennessee to kind of help walk through that. As we look at other community resources in Middle Tennessee, we're an information and referral kind of organization. So folks call Council on Aging of Middle Tennessee. We try to get them to the next best number so they don't have to make a lot of other phone calls. But some of those are the folks that I've mentioned already. But also I would encourage you to certainly call Mental Health America, who is making these productions possible. They are a wonderful resource for mental health issues. Also, the Alzheimer's Association of Middle Tennessee is a great resource for dementia-related diagnoses, what questions families may have, and then also getting connected with a support group. Those have been hugely beneficial to folks that we've talked with who are looking to make sure they're plugging in the right things and getting resources and getting support that they really need to look at all of these overwhelming issues that involve older adults. The Council on Aging is very proud to be here. We are very grateful to Mental Health America for making this series possible, and we hope that if you need our services, you can certainly call us. Hope you have a wonderful day, and thank you so much.